the director of the Department on Disability Services. As always, I will begin with our data. Let me begin actually by sharing the data so that okay, so so far, we have had 398 people who have tested positive for coronavirus. As I've said, this includes two people who, both of whom tested positive twice. Both tested positive in April. One then subsequently tested positive in December, and the other one in January. In the month of January, we had 55 people who tested positive, which is the highest number we have had since April. I'm hopeful we will start to see that begin to go down, as we've seen in the city and the country. It does seem that the numbers are beginning to go back down. So by provider type, in host home, we have had 6 people test positive. In intermediate care facilities, 111. In mental health facilities, 1. In natural homes, 48. In nursing homes, 2. In out-of-state placement, 4. In residential habilitation, 34. And in supported living, 192. And just as a reminder, there is the graph on the left that shows for each of those placement types the percentage of people, or the numbers of people supported by DDA in each different placement type. Because, as I've said before, even though 192 people represents a significant percentage of the people who have tested positive, they also represent a significant people that are supported by DDA. So if we look at infection rate and death rate by placement type for our major placement types, of the 111 people in ICFs, that represents about 37% infection rate, so 37% of people in ICFs. Of those people in ICFs who have contracted COVID, 18% have died subsequently. However, to date, only 10.8% of those have been confirmed as COVID related. We are still, I'll talk about this later, we're still awaiting the final cause of death for a number of people. Within natural homes, of the 48 people who've tested positive, this represents about 5.15% of the people who are in natural home placements. And of those 48 people who have tested positive, there have been 5 who have died from COVID, all of which are confirmed as COVID related, representing about 10% of the people who had COVID. In residential habilitation, we have seen an infection rate of 30.9%, representing 34 people. And of those 34 people, 3 have subsequently died. 2 of those to date have been confirmed as COVID related, so that the death rate from confirmed COVID is 6.25%. And overall, for people supported by DDA, we have had, as I said, 398 people who have tested positive, which represents about 16.56% overall. Of those, we have had 46 deaths. However, only 33 have been confirmed as COVID related, representing a death rate of people with COVID supported by DDA of 8.29%. So if we look at COVID-19 by placement type over time, In ICFs in January, we had 9, which is way up from December when there were none. And what we actually see over time in the fall, in November, we saw a spike in ICFs as well. In our congregate settings, when a person tests positive, we are seeing outbreaks within the setting. And so in residential habilitation, we've had 1 person in January. In supported living, 34. And in natural homes, 11. And so the biggest increase we've seen have been in supported living and natural homes. Of the people who required inpatient treatment for COVID in January, it was 9 people. Overall, it's been 137, and there are currently 4 people who are still in the hospital, including someone who's in long-term care who's getting rehab before being able to transition back home. People diagnosed with COVID who've subsequently died, as I said, there have been 46, including 2 people who had COVID, who had COVID, who died in January. Neither one of those on the next slide is listed as a COVID-related death yet. We're awaiting confirmation from OCME on 6 out of the 46 deaths, and 7 we've gotten confirmation that excluded COVID as the cause of death. Of the 2 who died in January, one of them had COVID all the way back in April, the other one in August. They had both recovered from COVID. So while we're including them here in terms of people who've been diagnosed who have confirmed COVID, to date, that's 33 people. And as I said, there are 6 where we are still awaiting confirmation for the final cause of death from the Office of the Chief Medical Examiner. And then among our provider staff, we have had 619 provider staff test positive for COVID. 45 of these staff worked for more than one provider agency, and sadly, 10 of the staff have died from COVID. So just by way of an announcement, we have some upcoming, as people may be aware, I expect you're aware. So we have our rights and COVID discussion, which has occurred amongst all of our DDS staff, all of our DDA service coordination staff, as well as many of our provider staff. And we also worked with some folks to develop that PowerPoint so that we could also have the discussions with people we support and their family members. And so those sessions are coming up. So the Assuring Rights, the discussion for people supported by DDA, session 1 occurred yesterday. We have a session next Thursday from 2:30 to 4. It's on Zoom. And we have a session on Friday, February 19th, also from 2:30 to 4, and that is also on Zoom. And then for families and supporters of people, we will be having a session on Monday from 10 to 11:30, and that's on Zoom. A session on Friday, the 15th, from 10 to 11:30, on Tuesday, the 19th, and on Friday, I'm very sorry. I get a little confused. Time's going by really fast. So our last session is this coming Monday, February the 8th, from 10 to 11:30. And perhaps, Crystal, someone could put in the chat exactly how people go about registering for these, because I can't copy from the document I have. As a reminder to people, if you have questions, please type them in the chat. Please remember to scroll all the way to the bottom of the chat and type your question to everyone. When I open the chat, it defaults to all attendees. And if you type it there, I won't see your question, but everyone else, everyone who's listening, but not able to respond to your question will be seeing it. So please type your question to everyone so that we can see it and respond to it. Is there a timeline for the second dose for the vaccine for people we support? And I'll just say once again, this week, we are very happy. I'm very happy to have, and I think all of our folks here are, because they've been very helpful in this, to have staff from DC Health join us to respond to questions. So I think Karen Stringfield with DC Health, who has worked with DDS on coordinating vaccines so far, could respond to this. Is there the timeline for the second dose for the people we support? And I assume that question is related to the approximately 130 people who got their first dose last week. Karen?
Yes. Hi, everybody. The short answer is yes. With the Moderna vaccine, the timeline for the second dose is 28 days, give or take about 3 days, plus or minus. So we're looking at the week of February the 21st. So more information on that coming. The layout will pretty much be exactly the way it was before, where those who have received the first dose will sign up for an appointment to receive their second dose, and we will block off that time at the Kenilworth Rec Center to make sure everybody is accommodated.
Thank you. The next question, if staff have been fully vaccinated, what are the quarantine requirements if they travel outside the DMV area prior to them being able to return to work? I believe
that question.
Folks can, thanks.
Yeah, hi, directors. Okay, so for any individual that is traveling outside of DC, I can put it in the chat, but the phase 2 guidance for travel is posted on our website. That is applicable to anybody who has been fully vaccinated or not. There is no difference between the two at this time. And that guidance document really outlines essential travel and then the requirements for quarantine for those that are returning to DC. So it does outline limiting daily activities for 14 days upon returning, or limiting daily activities and getting tested for COVID-19 within 3 to 5 days after returning to DC. And then it outlines a lot of those different things. I will say, however, that as a employer, your policy and your procedures can be more stringent than that guidance document. So as an employer, you can require additional things from those that work for you when they travel to high-risk areas. Thanks. And I'll put that into the chat for everyone's reference.
And just as oh, I'm sorry, go ahead.
Oh, sorry, I was going to say, for those that joined on the phone, you can find that guidance under coronavirus.dc.gov and go under the tab phase 2, and you'll find that there if you're not able to see it, the link.
So just as a reminder to people, which I think Daryl talked about a couple weeks ago, the vaccine is an extra layer of support, an extra layer of protection. And getting the vaccine does not change the need to continue to implement all other layers of protection, including, for the staff using the required PPE, surgical or procedure masks, face shields. It's, maintaining physical distance to the extent you're able. for people making sure you wear a face mask when you go out of your home, washing hands regularly. None of that changes when you get a vaccine. The vaccine adds another layer of protection. So there's a question about the status of planning for the people in ICFs and res habs who did not get in with the initial group of people to get their vaccine, as well as supported living and natural home. Karen.
This is such a common question. Again, the short answer would be that it's an ongoing process to get these things done. We have a lot of initiatives that are going on in DC right now to make sure that we are having the vaccine accessible to those very vulnerable populations that we're seeing have been affected in DC. So right now what's happening is that we have a lot of people that are now eligible that and limited appointments, limited vaccine. So I guess the less complicated answer would be that we will continue to work with DDS to try to figure out how this is going to go. We need to first prioritize those second doses with the people who have received the first dose. And then we can move on from there. We have to make sure people get their second doses just because we know that the vaccine is most effective with the 2 recommended doses. We also will be, yeah, go ahead.
Do we have plans for it's about 90 people who did not get vaccinated in the first round? Although that's a whole mix of people, so I don't know.
Yeah, so what we were thinking about today is to just look at the appointments that are coming up for the second dose. And this is not set in stone yet, but we wanted to see if there were any extra appointments in that time frame, if we could put more people to get their first dose in that 2-day time frame as well. And then kind of add on either a third day or have them coordinate with the giant pharmacy so that they can get the second dose. But that is dependent on how many appointments are available within that 2-day time frame. Other than that, we just have to keep working with our partners. I know that we're going to be opening up another DPR vaccination site within the next week or so. So that will help us a lot with planning on like the mass vaccination sites, but there are just so many other pieces to the puzzle. And I understand that everybody kind of wants to be in on it. And, we have some very vulnerable people in the DDS populations. However, we just need to make sure that we have an equitable situation going where we're not knocking other people off who are also vulnerable, solely to make sure that that those populations are serviced.
So there's someone here who asked if they were already given a follow-up appointment when they got their first vaccine, do they still need to schedule the second vaccine?
Are we talking about staff or are we talking about individuals?
It sounds to me, so it could be either, and I don't know.
So I'll say if it's staff that have already gone to get their vaccination through through the portal, then they should have gotten a second appointment at the time of their first dose. Correct me if I'm wrong, but for our 2-day clinic at Kenilworth, I don't think that there was a second clinic set up at that time, which is what we're going to try to coordinate within that week of the 21st.
That is correct, but we also have some people who are 65 and older who could have gotten in through the regular system.
If they got in through the regular system, yeah, if they already have an appointment.
Like everybody else.
Yes, exactly.
The ICF people that went to the ICF folks that were vaccinated at the rec center Does this say did receive or did not receive? Did receive an appointment date while they were there.
Very good. Okay, that's awesome. I'll get with our contact at Giant Pharmacy just to see what that was, if it was a range or if it was a tentative date or whatever. So that's fine.
So we'll clarify that with Giant and
Yeah.
have a response next week, which is prior to the date that vaccine is due. I'm trying to get back up because there was a question earlier on that I did not. Can a new provider require 2 negative results before a person transfers to them for services for a person who's been recently positive? That's a good opportunity for us to advertise, and it's gone out. There's guidance coming. There's a, is it a nursing roundtable that, and Winslow, you could fill in, Daryl Hawkins will be providing for all of our provider staff regarding ending isolation, because this idea of 2 negative tests is kind of dated guidance, if I'm not mistaken. I can defer to DC Health on that. But also conditioning accepting a client based on a negative test would raise another concern for us. But in terms of the guidance about when a person is considered to be no longer infectious, maybe Daryl, you could answer that briefly and then just remind, or Daryl or Winslow, if you can remind people of when that event is coming up in the near future, that and which staff have been invited to it.
Yeah, thanks, Director Reese. You summarized it pretty well. Yes, that is outdated guidance. Our guidance, both for return to work for staff that have been positive for COVID-19 and also discontinuation of transmission-based precautions for persons supported with confirmed or suspected COVID-19 in healthcare settings. Also, both of them say that the test-based strategy, which is what those two requiring 2 negative tests after someone has positive, the test-based strategy is not recommended by DC Health. There's as an exception, it may be considered for some rare instances. So for example, for individuals who are severely immunocompromised, which is defined very specifically in our guidance and by CDC. So that's one, and we are going to have a deeper dive to remind everyone about these guidances next week on Wednesday. And so hopefully everyone has received that. So folks are invited to attend that. I think it'll be hopefully a helpful training next week on February 10th.
And Karen referred to DPR, which is Department of Parks and Recreation, and it was Department of Parks and Recreation staff who were some of the folks who helped coordinate the 2 days that we had last week of vaccinations. Staff who, by the way, were, for the time I stopped by, were wonderful, just in terms of their customer service and ensuring that they were safely interacting with everyone and that everyone was maintaining safe distance between each other. Is it possible to set up a designated portal for our staff and people supported? It's challenging to get in before the appointments are exhausted. No. So what we did do is have, and we are talking, and think I mentioned this last week, we are talking with DC Health about whether this, we can do this more times. What we did do was have a separate registration for folks in ICF and ResHab supported by DDA, which did not go through that portal. But the DC Health has just that one portal. So when we have special events, they set aside that vaccine for that, and then we coordinate that separately, but it's not like a separate portal that's set up under the vaccinate.dc.gov. So there's a question, but mostly a comment. Will the additional vaccination site include supported living, in-home, and other waiver participants? No, the vaccination, the coordination that Karen was referring to was related to the second vaccine for folks, which sounds like may or may not be necessary to do. We are continuing to have discussions with DC Health about the availability of vaccine. As I said, it gets set aside and then we do a separate event for that about the availability to do that kind of event. At this time, I'm sorry, I didn't read the whole. So it is an equity issue, equity of access opportunities for a population that is more at risk, not only for COVID, but also for adverse outcomes. People who are at higher risk based on underlying health conditions are in priority 1C in the first phase that rolls out of 1C. And we are currently in 1B. I'm forgetting what the three sort of subcategories of those are called, but we're in 1B2. Next would be 1B3, and then we get to 1C. So at this time, that's where people with underlying health conditions placing them at higher risk are included. There's a question, when will vaccines be open to other people in the waiver when we get to 1C? I don't know, and Karen, maybe you know, if there's any estimate at this time about when we will be to 1C based on the vaccine that's coming in.
I don't have a definite timeline. What I do want to say is that just to address the additional vaccination site, just for clarification, the vaccination sites that we have will be open to the public, as Director Reese said, that we do actually shut down those public sites just to have these specialized clinics. So it's not necessarily just to get the population for DDS, but it is just to make sure that we are reaching more and more people. There is an issue of storage, of handling, of inspection, and just basically implementing our no waste policy. So that is what a lot of people see behind the scenes as making sure we are doing our due diligence. To the public, it may look like it's kind of lagging, but we're just making sure that everything is executed so to protect everybody's health and safety that's going to be receiving the vaccine. As I mentioned last week, our allocations are trickling up just a little bit. They're moving a little bit slower than we thought that they were, but the Biden administration has now said that in addition to our allocation that we get specifically for DC, they're also going to be providing us with federal allocation straight to pharmacies. So that is going to give us more vaccine doses and appointments. Also, Johnson & Johnson should be coming up very soon. So that will actually add to the amount of people that are getting vaccinated and kind of move it along a little bit faster. However, I don't want to stick to a specific timeline because if that doesn't happen next week, y'all are going to be yelling at me again. So, we're following the process and we're making sure that everybody gets vaccinated. I understand the anxiety, I understand the frustration, but I just want you to know that we are tackling a lot of issues, and for over 700,000 residents and however many healthcare professionals that work in DC but don't necessarily live in DC, we have to devise plans that are going to address getting each one of those people vaccinated. So it does take time, and I just appreciate everybody's patience and just making sure that you understand that this is going to be a process. We didn't get COVID in one day. We're not going to get rid of it in one day. So that's the main point of this whole thing.
Thank you. Next, so someone is asking, can we do a special event for staff that is similar? I don't know. We can raise that issue with DC Health. We are surveying agencies now regarding the status of staff vaccinations. The reason I pause so significantly is, our staff is over 4,000 people. And I haven't heard the full numbers. One thing I would like to say, there was a nursing roundtable this week at which they discussed the issue of vaccination for staff. And one of the agencies did what I heard was a really good presentation of how their agency prepared their staff in terms of the vaccine. And they had several education sessions with their medical director, who was there and available to answer all questions, to address, some myths that are out there about the vaccine, and really provide good education to people so that people did buy into getting the vaccine. And I understand they found that very successful in terms of the rate of people choosing then to get vaccinated. As I said, we're just collecting that data now, so I'm not sure where we stand exactly. We can keep talking about, as a healthcare population, what options there could be for these folks to get the vaccine. For people in ICFs and ResHabs, it opened December 26th, and it's really unfortunate that not all of them were able to immediately get in, because once January 11th came and we moved into phase 1B, there's been a lot more competition to register. Since people in ICFs are starting to get their vaccines, is there a timeline as to when people in ICFs could be returning to their day programs? This is a really good question, in that it gets back to what I said earlier, which is that the vaccines are an extra layer of protection. Keep in mind, and we've reviewed it here before, and maybe I should go back to reviewing it regularly. We are currently in phase 2 of reopening. And it's that guidance that controls people's ability to be going out into the community. And certainly our hope is that the vaccine being widely available is going to have an impact on some of those metrics, in that we'll start to see the metrics change. But what people need to be following there is not, am I vaccinated, therefore can I do X, but they should be watching the reopen DC guidance. As I say, we are still in phase 2, and the guidance is at coronavirus.dc.gov, and you can watch the metrics there in terms of what things people can be doing. We really do need to talk some more about how people will be engaging in meaningful activities during the day while remaining at home, because the reality is it is still going to be months before we see, a reopening, like, people getting on a bus and going back to a day program. In fact, to some degree, one of the positive things about the past year is that it has offered the opportunity for us to be much more person-centered and individualized in planning for each person and how to identify meaningful day activities for that person. And so, my hope is that will filter into the planning as we do get back to what looks something like normal. But the short answer is we still watch the reopening metrics in terms of when we go back. And as I said before, the vaccine is one more layer of protection. It's a layer of protection for you, so that each person, when they're able to get it, should get it. And as we get to a certain percentage of the whole community having it, then we'll all be in a better place. But in the shorter term, if everyone who works in a particular placement has had the vaccine, they also reduce the risk at that placement. And so we really need to be seeing our folks get more vaccine. But for now, if you have questions about what you're allowed, what activities we can engage in, go to coronavirus.dc.gov and you will see the phase 2 reopening metrics. Is there any consideration for the DDS weekly vaccination report from providers to be biweekly? There's a lot of follow-up with staff to determine if they've received the first dose or the second dose. We can certainly take that into account. The most important thing is that we would like to have a number, and those are numbers that at some point won't be changing all that much. So Kirk is not here to answer that question, but we could certainly take that into account. What recommendation for high-risk persons that are not 65 or older? I assume that question is, what are we supposed to do given that we can't get the vaccine until we get to 1C? Continue doing everything that you have been doing. Hopefully you have not gotten COVID since last January. And continue taking all those same measures. Continue wearing a face mask, continue, keeping a safe physical distance, washing hands regularly, continue to live that safe lifestyle, even after you get a vaccine. Do we know what day services will look like moving forward, specifically individualized day services? Are day programs meeting monthly like we used to discuss how we will pivot or remain solvent? Is there any information? Well, let me stop there and then I'll answer the other questions. So we are actually, I see your next question and I'm answering it in this one. Is there any information regarding the Appendix K? Will there be an extension? Okay, so first of all, the current Appendix K, which was to expire on March the 10th, 2021, was extended for 6 additional months till the end of September 2021. We are also working on drafting some amendments to that Appendix K to address some of the issues related to day services, including things related to IDS, location that services can be provided, and these kinds of issues. Unfortunately, one of the things that was not allowed is that the retainer payments that were allowed under the Appendix K could not be given for another year, could not be, once the original 90 days were exhausted, there's still no option for any additional retainer payments. The day program meetings, I'm not certain whether you're referring to, I know the Provider Coalition has day program meetings, and did we also? I don't know if Tasha is on this call and can answer that question, because we definitely should be having such meetings so that people can share amongst themselves about the things that they are doing. Well, I know there were monthly meetings, but were they Provider Coalition meetings or were they DDA meetings? And so, because they definitely should be happening. So I will speak with the folks who used to have those and find out what's up with those, because we should be having those. We really need, it is essential to be talking about how people spend their days and to be talking about how we ensure that our providers remain solvent, so that when this is over, our day providers are there. But in the interim, the way that those services can be provided is going to be different. And we really do all need to speak together about how that can occur. And so those should be happening. And I see Tasha started typing something. She is a panelist now, so perhaps she would like to speak to that.
Can you guys hear me?
Now we can.
Okay, great. There have not been regular monthly day meetings as there had been previously, but of course they can be resumed. So I agree with everything that you said, and do know we have been talking about the impact of COVID on day programs and ways in which residential providers and day providers can work together to get people more engaged and to support the day providers' continued ability to serve folk. So that can be something that we can resume. So as you said, Kirk's not here, but we can talk and within QAPMA about how to resume the day meetings.
Does DC Health have a recommendation regarding vaccinations for people who are receiving hospice?
I don't know that there is any recommendation for or against. I would say go on the advice of your healthcare provider. If Daryl has any other insight, I would more than welcome that.
No, I would have said the same thing you said, Karen. Yes.
There's just a comment here. There are people who in supported living who are, it says, extremely high risk, who are very high risk for serious outcomes from COVID. That is true, and they are in Group 1C at this time. One of the distinctions is that in supported living, an ICF has 4 to 6 people. And so as you saw from the numbers at the beginning, the infection rate amongst people in ICFs was higher. In making the determination about who to include in the group in 1B, we shared all of our data with DC Health. And as Karen was saying, these are really difficult decisions to make because they're looking at our population, but they're looking across the city at all populations and trying to prioritize and get everyone vaccine as soon as they can with certain priorities. So they are doing their best to get it out to everyone. The reality is it's not going as fast as any of us would like. I think that's a fair statement. I've heard Dr. Nesbitt say regularly the district needs to receive more vaccine. I don't see any other questions. I'll just sort of as a summary, let people know, and then you can type in if I'm missing something. We will have a follow-up next week regarding resuming monthly day program meetings. We will check into this question of Giant providing the second vaccination for folks who got the vaccination last week. And my hope is that we will have an update next week regarding any proposed changes to our Appendix K. And this isn't just for next week, but I expect I'll be out.
Just hold 1 second, everyone, while Director Reese fixes his computer. It's probably a bandwidth issue. But I
just got a message from the director that he have what we lovingly refer to as the blue screen of death. It's where you get this sad face and your screen just turns blue, and there's really nothing you can do about it until you boot back up. So he wants me to close out the call or take any questions that are. Oh, here he is.
Sorry about that. I'm not sure exactly where I cut off. We will continue working with DC Health on the issue of how quickly we can get to people in supported living and in natural homes, and whether we can schedule that as a separate event rather than, relying on them having to use the portal.
And I left a note for everyone in a chat box that our public information specialist will send out more information regarding the COVID rights discussions.
So it appears we have no additional questions. It's 12:57. We'll just leave this open until 1 o'clock so that if people have any questions, please feel free to ask them. But otherwise, have a great weekend, everyone. Please continue to stay safe and, and patient. As Karen said, we understand everyone's anxiety about, now that the vaccine is here, getting it out to as many people as possible. And this process is moving slowly, but it is moving. And so please continue to stay safe and ensure the people around you are as well. And hopefully we will all get to a point in the next period of time that we are all vaccinated. So have a great weekend, folks.